United States is on the brink of a significant shift in its approach to vaccinations, a change that could deeply divide the nation. A growing rift between state and federal authorities is reshaping the landscape of immunization policies, potentially leading to a fragmented system where each state operates under its own set of rules and recommendations. The situation has been exacerbated by recent turmoil at the Centers for Disease Control and Prevention, CDC, where the firing of Director Susan Monterez and the subsequent resignations of top scientists have raised concerns about the politicization of public health. This instability has prompted several states to take matters into their own hands, leading to a patchwork of vaccination policies that vary widely from one region to another. But here's where it's controversial. Some Republican-led states are rolling back or eliminating vaccination mandates, while Democrat-led states are diverging from CDC guidelines to create their own protocols. For example, California, Oregon, and Washington have formed a public health alliance to provide credible information about vaccine safety in response to the CDC's recent controversies and the FDA's new guidelines for COVID shots. New Mexico and Colorado have taken steps to remove barriers and ensure access to COVID-19 vaccines, while Florida's Surgeon General, Dr. Joseph Ladapo, has moved to eliminate vaccination mandates across the state, including in public schools. Other states like Texas are considering similar measures, with dozens of anti-mandate bills introduced in the legislature. This divide is fueled by long-debunked but increasingly mainstream claims about the health risks of vaccinations, which have gained traction during the pandemic. Dr. Peter Chin Hong, an infectious disease expert at the University of California, San Francisco, notes that repeated exposure to misinformation, such as the false claims that vaccines cause autism or alter DNA, can erode public trust in immunization. For decades, the federal government has worked closely with infectious disease experts to develop comprehensive vaccination guidelines. These guidelines have been used by states and medical organizations to administer millions of doses, and insurance companies have relied on them to determine coverage. However, the rise of vaccine hesitancy and the spread of online misinformation have turned vaccination mandates into a political battleground. And this is the part most people miss. The pandemic has not only highlighted the effectiveness of vaccines in reducing hospitalizations and severe cases, but has also exposed deep-seated distrust in the medical establishment. This distrust has created a rift that threatens to split the country into two distinct zones, defined not by geography, but by state government stances on vaccination mandates. In an op-ed in the Wall Street Journal, Health and Human Services Secretary Robert F. Kennedy, Jr. criticized what he called irrational policies, such as mask mandates for toddlers and lockdowns, which he argues had a devastating impact on Americans. While lockdowns and school closures did have economic and mental health drawbacks, the vaccines were crucial in preventing overwhelming healthcare systems and reducing the severity of the pandemic. The introduction of mRNA vaccines in late 2020, following significant investment by the Trump administration, marked a turning point. However, the novel technology and the uncertainty surrounding the long-term effects of the vaccines contributed to the fear and skepticism that persists today. Dr. Chin Hong explains that the vaccine became an easy target for people grappling with a sense of loss and a perceived erosion of personal freedoms. Kennedy, a prominent figure in the anti-vaccine movement, has taken a series of actions that have further eroded trust in the CDC. He disbanded a 17-member independent vaccine advisory committee and replaced it with individuals skeptical of vaccines. He also cut $500 million in mRNA vaccine contracts and limited the CDC's recommendations for COVID vaccinations to adults 65 and older and those with specific pre-existing conditions. The American Academy of Pediatrics responded by issuing its own recommendations, marking the first significant divergence from federal guidelines in 30 years. Dr. James Campbell, vice chair of the Academy's Infectious Diseases Committee, emphasized the need to make the right choices for children's protection, despite the confusion this might cause. The governors of California, Oregon, and Washington have also taken a stand. vowing to provide unified recommendations based on science rather than politics. They warned of severe consequences if the CDC continues to prioritize ideology over evidence-based practices. The HHS has defended its actions, stating that the Advisory Committee on Immunization Practices, ACIP, remains the scientific body guiding immunization recommendations. However, the recent firing of CDC Director Monarez and the subsequent mass exodus of top officials have further undermined public confidence in the agency. As the federal government falters, states may begin to craft their own public health orders, and insurance companies will have to navigate the changing landscape. The Affordable Care Act and the Inflation Reduction Act of 2022 ensure that vaccines recommended by ACIP are generally free. But the future of coverage decisions remains uncertain. The ongoing crisis at the CDC has sparked a broader debate about the role of federal agencies in public health. Former CDC directors have accused Kennedy of endangering Americans and called on Congress to exercise oversight. Kennedy, in turn, has defended his decisions, arguing that the CDC must refocus on infectious diseases and restore public trust. As the nation grapples with these changes, the question remains: will the fragmentation of vaccination policies lead to a healthier, more informed public, or will it deepen the divide and compromise the collective effort to protect public health? What do you think? Share your thoughts in the comments.